Good morning, sir. I'm Rowena Doctor from BSN 22, and I'm going to perform assessment of the head, neck, and regional lymphatics. Equipment, we have a stethoscope and a cup of water. Procedure step, explain the assessment to the patient and secure consent. Sir, I'm going to assess you um, of the head, neck, and regional lymphatics. Instruct the client, explain that you will touching the client in the various areas with different parts of your hands. Sir, I'm going to touch your body or your neck, head, and regional lymphatics by performing this assessment. Provide warm and well-lit room. And we're going to start with the head. Head and neck, inspect the shape of the head. Have the client sit in a comfortable position facing the client with head at the same level at the client's head. Inspect the head for shape and symmetry. Palpate the head, place the finger pads on the scalp, and palpate all the surfaces, beginning in the frontal area and continuing over the parietal, temporal, and occipital areas. Assess for the contour masses, depression, and tenderness. Palpate the temporal artery which is located anterior to the tragus ear. Frontal area, parietal temporal, and the occipital. And temporal artery. Inspect and palpate the scalp, part of the hair repeatedly all over the scalp, and inspect the scalp for lesions or masses. Place the finger pads on the scalp and palpate the lesions and masses. The skin is normal and have no lesions. Inspect the face. Observe the client's face for expression, shape, oval, round, slightly square, and symmetry. Of the following structures, eyebrows, eyes, nose, mouth, ears, note any swelling abnormal features of unusual movement. The eyelashes are evenly spaced and curled. The eye is evenly, the bulbar conjunctiva is clear with tiny vessels. The ear is non-tender and the nose pink and moist with uniform color and no lesions. Palpate and auscultate the mandible. Use the fingertips of both index and middle fingers. Locate the tempora mandibular joints anterior to the tragus of the ear on both sides. Hold the fingertips firmly and place over the joints and ask the client to open and close the mouth. Sir, can you please open your mouth and close? Sir, can you please open your mouth and close? Observe smoothness of the movement and whether or not the client notices any discomfort. Remove the hands and hold the bell of the stethoscope over the joints. Listen for any sounds while the client opened and closed the mouth. Sir, can you please open your mouth and then close? Open, then close. Inspect the neck with the head in the central position. Inspect for symmetry or sternomastoid muscles anteriorly and the trapezie posterior. Have the client touch the chin to chest, to each side and each shoulder. Assess for limitation of motions. Note the presence of stoma or tracheostomy. Sir, move po natin yung chin down po, down. Side. The other side. Palpate the neck. Stand in front of the client with the finger pads. Palpate the sternocleidomastoid muscles. Note the presence of masseter tenderness. Stand behind the client with the finger pads. Palpate the trapezius and note the presence of tenderness. Inspect the thyroid gland, secure tangential lightning and shine it on the oblique angle. The client anterior neck face, and ask the client to straight ahead with head slightly extended. Have the client drink or sip of water and swallow. Twice. Ask the client swallow. Observe front of the neck and area of the thyroid and isthmus for masses and symmetrical movements. Stand straight, sir. Drink po ng water. Palpate the thyroid. Posterior approach. Place the thumb on the back of the client neck and bring other fingers around the neck anteriorly with their tips resting on the lower portion of over the trachea. Move the finger pads over the tracheal rings. Instruct the client to swallow and palpate isthmus, nodules, or enlargement. Have the client incline the head and slightly forward. Press the fingers of the left hands against the left side of the thyroid cartilage to stabilize while placing the fingers of the right hand gently against the right side. Instruct the client to swallow sip of water. Note consistency, nodularity, and tenderness of the glands. Move upward. Repeat on the other side.
American people, the Cambodia people, or Aitas, small people.
Anterior approach grabs the elevated and displays right lobe on the thyroid gland with the thumb and index finger of the left hand. Palpate the surface of the gland for consistency, nodularity, tenderness. Have the client to swallow, then palpate the surface again.
What are they? The lonely plan of my
Auscultate the thyroid gland. Stand in front of the client. Place the bell of the stethoscope over the right thyroid lobe. Auscultate for bruits. Repeat of the left thyroid lobe.
So may I flip your head? I something. Wala ka maganda. See, that's really about the client.
Inspect the lymph nodes. Stand in front of the client. Expose the area of the head and neck to assess. Inspect the nodal areas of the head and neck for any enlargement or any inflammation.
How namin Bolivia. Recently, they came back inside the class. Every Santos. I said, it's still active.
Palpate the lymph nodes. Have client sit comfortably. Feel the face client and conduct the assessment on both sides of the neck. Simultaneously, move the pads and tips of the middle of the three middle fingers, small circles of palpation using gentle pressure. Follow a symmetric routine sequence. Begin with the preocular, post-auricular, occipital, submandibular, and tonsillar nodes. Moving down to the neck, um, evaluate the anterior cervical chain, the posterior cervical chain, and the supraclavicular chain. Now we have to check the preauricular. And the post-auricular submental submandibular and the tonsillar nodes. When we have to go to the neck, we have the upper posterior cervical, and the supraclavicular nodes. Node size, shapes, delineations, mobility, consistency, and tenderness.